helping make your life easier. Moms Every Day.
Welcome to Moms Every Day, talking a little bit about your health today with Dr. Frank Shuler. Dr. thank you for being with us.
Oh, thank you very much.
We're talking in particular a little bit about a problem that really affects a lot of people and can be very dangerous. We're talking about the possibility of, as you age, falling down and breaking a hip, and that is a very serious scenario for someone. Tell us why.
Sure. The risk of fall increases as we get older. Things like vision changes or bounce disturbances increase the risk of falling, and combine that with age-related decrease in bone strength, you increase the risk of having a fracture. Your viewing area, and we are particularly at risk for this problem because we're the second oldest state in the country at greater than age 65. Your risk of having a fall is 30% within a year for age 65. As you get older to age 80, 50%. So the chance of having a fall increases as you get older. Chance of breaking a bone increases as you get older. So it's definitely a problem.
The bones just simply aren't as strong.
Simply aren't as strong as we get older, correct.
And is there anything you can do to that before we get to the problem of the breaks?
Absolutely.
Could you strengthen the bone in the first place?
The key is detection, though. It's a silent disease. So I'll give you an example. If you see people walking, an elderly patient or an elderly person that say, my height has decreased over the years, that's actually a fracture going on in the spine. One of the things that happens, those are not associated with pain. Almost 3/4 of them don't hurt. The fractures we're talking about today are things like the wrist, shoulder, and hip that are associated with problems.
Very serious pain.
Even serious pain and even potential for death. So that's exactly right. So the concern is, what can we do to help prevent these from happening? And we've established a program that's comprehensive to take care of patients that do have these type of fractures, but also see what we can do to prevent them from happening in the future.
You said something just a moment ago that might shock some people.
Okay.
Fracturing a hip or some such can be life-threatening. How so? Absolutely.
So first off is all comers, the risk of having a fracture for females, say for example, 50% over a lifetime. Those that fall and break a hip, 50% can't get up after that fall. 25% pass away within 1 year of having that fracture. I am not immune to this. You're not immune to that. People watching today are not immune to that.
You need to repeat that statistic you just
25% of people that have a hip fracture pass away within 1 year of having that fracture. It's happened to my own family. My grandfather fell, broke his hip, passed away in the post-operative period.
That is astoundingly serious.
Absolutely, and that's why protocols are in place at Cabell Huntington Hospital in our senior fracture program to decrease the chance of having problems after these fractures, and also see what we can do to prevent them from happening in the first place.
So now that there is such a warning out there, and aging happens to everyone, so that risk is there for everyone, is there something that someone who is beginning to get older should do, think about, take action now to ward this off?
Several things. So first off, most falls that happen in the bathroom. So make sure it's well lit. Make sure you don't have loose rugs. Get a bed rail. The other thing is if you think you're having trouble with vision, bounce, get it checked and tested. That is a huge important thing, because we all don't want to feel we're getting older, right? I need to probably even change my glasses right now. Get seen and tested for these very problems. Now, because it is a silent disease, talk to your doctor about it. What can I do to get what's called a bone density test? What can I do to find a problem before I have this structural failure and fracture?
Is there something of a follow-up procedure once I've seen a doctor a first time?
Absolutely. It starts with your primary care doctor to ask, what can I do for diet, nutrition, things to help out, and then identify the risk factors, from even something as simple as a medication review to getting your vision checked to doing a bounce assessment. There's many things that can be done to help decrease the chance of even having a fall in the first place. The thing that you want your audience to understand, falls beget falls. The #1 risk factor for having a fall is, did you have a previous fall? So if you're already thinking about getting that cane or walker or crutches, you need to see your doctor then to say, what can I do to prevent fracture from happening? What can I do to make my bones stronger?
A lot of people who go in the hospital have that asked of them. Have you ever fallen?
Yes.
And it's one of those questions, and you shake your head and you go, why do you care? I guess that's why you care.
Well, this is part of it too. It's because it is a silent disorder. The risk factor, as I mentioned before, 50% of females have a risk of these osteoporosis or weak bone fractures over their lifetime. That's greater than the risk of breast cancer, heart disease, and stroke combined. it's a warning sign that we need to pay closer attention to. So if you are thinking you're slipping, falling, have balance issue, vision problem, please start with your doctor and then go from there.
Dr. Shuler, thanks for being with us. Appreciate that.
Well, I appreciate your time.
If you'd like to learn more about this very serious situation, you can go to WSAZ.com and click on Moms Every Day. And we'll have more right after the break.